right, it looks like we're up and on. Hello, hello. Welcome to Facebook Lunch Live with CORA Physical Therapy. I'm Samantha Gach. I'm here in our Ballwin, Missouri clinic, and today we're going to talk about balance and stability exercises that athletes can use to help reduce their risk of an ACL tear. If you didn't join me with the last one that I did, like I said, I'm here in our Ballwin, Missouri clinic. I graduated in December and have been working with CORA since January. I grew up doing sports throughout my life. I've had several friends with ACL tears. I myself have not had one. Knock on this chair. But I know it's a huge problem for a lot of our young athletes and even any active individual throughout the lifespan. My mom, she actually tore her ACL on a family ski trip, and so this is not something that is only for young athletes. It's something that we all need to be aware of and make sure that we're training our body so it's able to handle whatever we want to throw its way. It looks like we've had a few people jump on, so we'll kind of dive into it a little bit. If you've followed sports at any point in your life, I'm sure you've seen athletes who have suffered career or season-ending injuries with an ACL tear, and it can really disrupt your season. In the U.S., there is 1 to 200,000 ACL ruptures per year, making an ACL tear one of the most common knee injuries that we might see. And while both men and women can suffer an ACL tear, women are up to 6 times more likely to tear their ACLs. It usually happens in a sport that requires quick stopping or starting, and jumping and landing, which is most sports. So this is just for about anyone. The good news is that there's a lot of really great exercises that we can do that will help train your body to be prepared for these movements and decrease your risk of injury. So the first step to knowing how to prevent an ACL injury is knowing what the ACL does. So I have our handy little knee model here, and we're gonna, this is your quadricep tendon, and so if we look underneath that and bend the knee, you can see this ligament here, and this is your ACL. So what it does is prevent your thigh bone or your femur from sliding too far back on top of your shin bone or your tibia. Now, what it also does, and why women have a higher risk, is women tend to be in more of a valgus position, which is kind of like knock-kneed, or where their knees cave in a little bit. And if we look at our ACL in that position, you can see it's pretty taut there as well. So that's why us women are at a higher risk before we even step onto the field, because that ACL is already taut. And if we do any movements with hard jumping and landing and don't have control of the knee, then it's already at a position that's taut and it can snap a lot easier. So now that we look at that, let's see. So one of the muscle groups that can help control the knee is the hamstrings. The hamstrings are on the back of your thigh, and they can help pull your shin bone back under your thigh bone, which will reduce the tension on that ACL. And we also have the hip abductors on the side of your hips that run down along the side of the knee that can help pull your knee out of that caved in position. And so if we're able to strengthen those and work on balance and stability, then we can make sure that your lower body is strong and prepared to perform your best and prevent some of these injuries. So next we're going to get into some exercises that will help us do exactly that. I have one of our students here today, Victoria. She's going to help us demonstrate some of these exercises. She is a student from SLU, and she'll be with us for
12 weeks.
For 12 weeks. This is her first week, so give her a warm welcome. All right, so the first exercise she's going to help us demonstrate is a Swiss ball hamstring curl. So what she's going to do, and I'll turn this down a little bit so we can all see her. But so she's going to bridge up onto this Swiss ball here, and curl her legs underneath her. And so you can see this requires a lot of stability and strength to do. Now, if you're an athlete and you're trying this and this is starting to get easy, what you can do is make it harder by doing it on one leg. This is really good to train those hamstrings as well as the stabilizers of the hip and the knee. All right, so next what we're gonna have her do, we'll stand up and I'm gonna give her a band. And we're gonna put this band around her knees. And what she's gonna do, we're gonna have her stand on one leg and then bring the other leg out to the side. And so this will help strengthen those hip abductors that can help pull that knee out of the caved in position. And if you can, like Victoria's doing, we want to try to do this without holding on to anything, just to create a little bit more of a balance challenge. But if you need to hold on in the beginning while you're getting used to it, that's totally understandable as well. All right, good. So the next one we'll do.
No band.
No band. We're switching to lunges on foam. All right, so what I'm gonna have Victoria do, we're gonna have her front foot on the pad and her back leg strided out behind her. There we go. And then she's just gonna bend that bottom leg down to touch the floor and come back up. Now, regular lunges are great as well, but I like using the foam pad just because it's uneven, like many of our playing fields might be. If you're playing soccer or lacrosse or anything on turf, then you know that that's not always a stable surface. And so training on the foam is going to be a really great way to make sure that your foot and your hip and your knee are all ready for those unstable surfaces. All right, good. So now that we've kind of introduced some of these movements and strengthened the hips and the hamstrings, what we want to start doing is practicing some of the jumping and cutting and landing that so many of our sports require. So what I like to do first is just a simple squat jump. And so whenever we're doing a squat jump, we'll have Victoria demonstrate here. And so you can see that her knees are staying out. What we want to watch for is to not let those knees cave in. And so if you're an athlete doing these at home, I recommend either having someone watch you or taking a video of yourself and watching and slowing it down to see, are your knees caving in or do you have good control? And so Victoria seems to have pretty great control of her knees, so we're gonna go ahead and progress her to the next one, which is called a skater jump. So what she's gonna do, this is a really good exercise to start training landing on one leg properly. And so we'll have her start on one leg and jump over to the other. And you can see she's taking a nice long pause and making sure she's stable before she jumps over to the next leg. And as she gets tired, these get harder, which is to be expected. But that's why we train that way, because very rarely are we at our peak throughout an entire game or an entire practice. And it's when we get tired that our injury risk goes up because we're losing control of that knee. All right, we'll let her have a little bit of a break here and catch her breath. So keeping that in mind, and again, this is with all of these, I recommend videotaping yourself and making sure that your knees aren't caving in and you have good control throughout all of these movements. All right, are we ready for the next one?
Yep.
All right, let's see. We had a PVC pipe cane. And so the next one we're gonna do, I'll let you just stand here for a second while I explain it so you can catch your breath a little more. These are lateral jumps. So she's gonna lay this cane, or if you want, you have tape or like a normal line to jump over, that's just fine too. This is just what we use here, so we aren't taping all the time and ripping up tape off the floor, and it's nice and low, so I don't have to worry about her catching her heel on anything to start with. And so what she'll do, we'll start with this with just 2 legs jumping back and forth over the cane. And so if you're ready, we'll go ahead and demonstrate. Good. And so again, making sure the knees aren't caving in. We can tell she's getting a little tired. They're starting to cave in a little more on us, but she's doing a good job correcting and pulling them back out. All right, and then after that, if that's starting to get easy, you're having good control, what we'll do is just on 1 leg, jumping back and forth over and working on that good control. A lot of times in sports, you might not get to land on 2 feet. You might just be coming down on 1, and so making sure you have good control landing on 1 leg is really important to reduce your risk. All right. So the last one we're going to demonstrate today is called a Z jump. And so we're going to get a box. We use a 10-inch box for these here. And what we're going to do, Victoria's going to start on top of the box and then jump out to the side on 1 leg and then back the other way. And so again, good control through all of these and making sure that she's able to land well on 1 leg and stabilize herself before jumping over to the other. Good. All right.
Good?
We're good. We're good. All right. Victoria did an awesome job with all of those. So the important thing to remember with all of these exercises is landing softly and not letting the knees cave in. As these exercises get easier, you can always progress them by, like with the lateral jumps, jumping over something higher. You can speed up the exercise is a really good way to do that, because very rarely in a sport situation do we have time to really make sure that the foot and the knee are stable before springing back into action again. So doing these faster, you can work on throwing and catching through all of these and add more sport-specific activities like that. A lot of these, especially as we get to the ones with the single leg exercises, making sure you're training both sides is crucial. I know a lot of people have a foot they prefer to plant on, but that doesn't always happen in a game setting, and so making sure both legs are just as strong as they can be is going to be really important to make sure that you are decreasing your risk for ACL injury. If you feel that you are at risk or you want a screening, please come in to any CORA clinic. We'd be happy to give you a screening and help you be the best athlete you can be. Thanks and have a great afternoon.